Welcome back to Daily Health Alert TV news and podcast. Today, we're taking a closer look at an essential topic in women's health, the signs of cancer that often go unnoticed. Our primary reference is an insightful article from WebMD titled Signs of Cancer in Women. Remember, this is purely informational and should not replace professional medical advice. Early detection is critical when it comes to cancer, and being aware of subtle signs can make all the difference. We'll be covering symptoms related to common cancers like breast, colorectal, lung, and more. These can include unexpected changes in the body, such as persistent pain, skin changes, or unexplained weight loss. Let's empower ourselves with knowledge so we can recognize potential warning signs and seek timely medical advice. Stay with us as we uncover these crucial insights.
Welcome back for another deep dive. Today we're going to be focusing on women's health, specifically signs of cancer in women.
Right.
And our main source material today is an article on WebMD called Signs of Cancer in Women.
Oh.
And as always, this is just for informational purposes. This is not a replacement for advice from your own physician.
Right, exactly. It's all about being informed and empowered when it comes to your health.
Early detection is key with cancer, so
Yeah.
the more we know, the better, right?
Okay, so jumping right in, the article kicks off by listing the most common cancers that women face.
Yeah.
Breast, colorectal, lung, cervical, endometrial, and skin cancer.
Yep.
And those are the ones we hear about a lot, but what I found so interesting was how some of the symptoms are things that you could easily miss or brush off.
Right.
Right. It's true. Cancer can be really sneaky sometimes.
Yeah.
It can mimic everyday issues, so it's crucial to know what to look for. Like, for example, let's talk about breast changes. I mean, everyone knows to watch for lumps, but it's not always that straightforward.
Right.
Right.
Yeah, the article mentions dimpling of the skin, like almost like an orange peel texture, and changes in the nipple, like discharge, or if it starts pointing inward. I had no idea. Those could be signs.
It's amazing how our bodies can give us these subtle clues, And speaking of subtle, bowel changes are another area where things can get a little, tricky, right? I mean, who hasn't had a bout of constipation or diarrhea? But
Right.
if it's persistent or your stools change in consistency, like if they become very thin or dark or there's blood,
Yeah.
that's definitely something worth investigating further.
Yeah, and that's where things get a little scary because we often link those symptoms to other things like PMS or just having a sensitive stomach.
Exactly. Precisely. And, women especially might dismiss these changes because they're used to fluctuations throughout their cycle.
Right.
But here's the good news. Doctors can actually screen for colorectal cancer before symptoms even show up.
That's amazing. So that's huge for preventative care.
Huge.
And it makes you realize how important those regular checkups really are.
Absolutely. Absolutely. It's all about being proactive.
Yeah.
Right? Speaking of preventative care, let's talk about pain for a second. Now, belly, pelvic, or back pain are practically a rite of passage for many women.
Yeah, I think a lot of us are just used to gritting our teeth and bearing it.
Exactly.
But the article really emphasizes persistent aches or pressure that don't have an obvious cause. And that could be a sign of cancers like colorectal, ovarian, or endometrial.
Yeah. And this is where connecting the dots becomes so important,
Yeah.
Like you mentioned back pain, but did you know that if that back pain is paired with persistent bloating, that could potentially signal ovarian cancer?
Wow. I never would have put the two together. That's a game changer for how we view those everyday aches and pains.
Absolutely. It's all about recognizing patterns and understanding when something might be a little off.
Yeah.
It's not just bloating with the back pain either. The article also mentions upper belly pain that spreads to the back, and especially when it's coupled with unexplained weight loss, that could signal pancreatic cancer.
See, that's so scary because those are such vague symptoms that you could easily explain away, like, oh, I just have a stomach ache or I'm stressed.
Yeah, exactly. And that's why it's so important to pay attention to those subtle shifts in our bodies. Speaking of those subtle shifts, let's talk about unexpected trips to the bathroom.
Okay.
We've all had UTIs, but it's important to remember that sometimes those symptoms can overlap with more serious issues like bladder or kidney cancer.
So how do we know the difference? The article mentioned blood in the urine as a red flag.
Oh, absolutely. Blood in your urine is never normal, and it needs to be addressed immediately. And while it could be a simple UTI, it's crucial to get it checked out to rule out anything more serious.
And what about other urinary changes? The article lists like frequent urination, sudden urges, difficulty emptying your bladder, that kind of thing.
Yeah, those are all valid concerns to bring up with your doctor. It's about being proactive and advocating for your health. And while we're on the topic of changes, let's talk about weight. Now, obviously, maintaining a healthy weight is important for overall well-being. But the article emphasizes that sudden, unexplained weight loss, like 10 pounds or more, warrants a conversation with your doctor.
It makes you realize how interconnected everything is. Like weight loss could be a sign of something else going on.
Right. It's like our bodies are constantly sending us messages. It's just up to us to decipher them. Speaking of messages, let's not shy away from this topic. That can be a bit sensitive. Non-period bleeding or discharge.
Yeah, I think a lot of women just tend to ignore those things, hoping they'll go away on their own. But the article makes it clear. Bleeding between periods or unusual discharge, whether it's bloody or smelly, can sometimes signal cervical, vaginal, or endometrial cancer.
Exactly. And it's especially important to remember that bleeding after menopause is never normal and requires immediate medical attention. No exceptions.
Like a giant flashing warning sign. So we've talked about a lot of physical changes, but what about things like fatigue? I mean, we all get tired, but when does it cross the line from normal tired to something's wrong tired?
That's a great question. It's really about distinguishing between that everyday tiredness from a hectic schedule or lack of sleep versus that deeper, persistent fatigue that doesn't improve with rest. That kind of exhaustion can sometimes be a sign of something more serious, including cancer.
And the article highlights how cancer can even impact your appetite, which I found really surprising.
Yeah, and there's a couple ways this can happen. Imagine a tumor growing near your stomach. It can actually push against your stomach, causing a feeling of fullness, even if you haven't eaten much. Additionally, tumors can release hormones that mess with our hunger signals, leading to a decreased appetite.
Okay, so that explains why some people with cancer experience such significant weight loss, even without trying. It's not just about being sick, it's about these physiological changes happening in the body.
Exactly. It's all connected. And speaking of interconnected systems, let's talk about those unwelcome nighttime visitors. Night sweats and fever.
Okay.
I know night sweats are a common part of menopause, but the article points out that intense, drenching sweats that happen frequently could potentially signal blood cancers like leukemia or lymphoma.
So how do we know if it's just a normal hot flash or something more serious?
It's really about the intensity and the frequency. Occasional night sweats are to be expected, especially during those hormonal shifts, but if they're consistently drenching you and disrupting your sleep, it's worth bringing up with your doctor.
And what about fever? Is that always a sign of something bad?
You know, fever is actually our body's way of fighting off infection, so it can be a good thing in many cases. But when it comes to cancer, fever can sometimes accompany blood cancers or occur when cancer spreads or affects the immune system.
That makes sense. Our immune system's working overtime when we have cancer, so it's natural for a fever to pop up sometimes. So we've covered a lot of internal signs. Let's move on to something a little more visible. Coughs. When should a cough send up a red flag?
Well, a persistent cough that hangs around for weeks and doesn't seem to have a clear cause, like a cold or allergies, should always be investigated. It could be a sign of lung cancer, especially if it's accompanied by hoarseness, which might indicate cancer in the larynx or thyroid.
And I remember reading a particularly chilling anecdote in the article about a woman who dismissed her persistent cough as just a lingering cold. Turned out to be lung cancer, and by the time she sought medical attention, it had already spread.
That's a heartbreaking reminder of why early detection is so crucial. We can't afford to ignore those persistent symptoms, even if we think they're nothing serious. And speaking of things we shouldn't ignore, let's talk about skin changes. Now, most of us know to watch for changes in moles, but skin cancer can manifest in different ways.
Yeah, the article talks about non-healing sores, crusty red spots, or any new or unusual growths on the skin. And it even mentions checking often overlooked areas like between your toes, under your toenails, and your scalp.
That's a great point. Skin cancer can develop anywhere on the body, not just in areas exposed to the sun. Regular self-exams are crucial, and it's also a good idea to schedule annual checkups with a dermatologist, especially if you have a family history of skin cancer.
Wow, it's amazing how many things we need to be aware of. This has been a real eye-opener.
It really has.
We talked about coughs and skin changes, but the article also mentions heartburn and trouble swallowing as potential warning signs. And you know, I don't know about you, but I wouldn't automatically think of cancer when I have indigestion.
Yeah, that's a common misconception. While occasional heartburn is perfectly normal, persistent or worsening symptoms, especially if they're accompanied by difficulty swallowing, gagging, or feeling like something is stuck in your throat, could potentially signal cancers of the mouth, esophagus, stomach, or throat.
So it's not just about the heartburn itself, but those additional symptoms that come along with it.
Exactly. It's about paying attention to the whole picture.
Okay.
And on that note, let's touch on a few other signs the article mentions. Things like unexplained pain, mouth changes, and swelling in the face or upper body.
Yeah, the article really emphasizes that pain is your body's way of telling you something's wrong, so we shouldn't just brush it off.
Right. Absolutely. Persistent pain that doesn't have a clear cause definitely deserves attention. And then there are those mouth changes like white or red patches that don't heal, persistent sores or lumps in the mouth. These could be signs of oral cancer, and it's crucial to get them checked out.
And I remember the article talked about swelling in the face or upper body and how that can sometimes be caused by a tumor pressing on veins, which can block blood flow.
Yeah, it's incredible how these seemingly unrelated symptoms can actually be connected to something much bigger. It's like our bodies are this complex web, and when one part is affected, it can ripple throughout the entire system.
Wow, that's a powerful image. So we've covered a lot of ground today.
We have.
It's been a bit overwhelming, but also empowering to learn about all these potential warning signs.
I agree. It's not about living in fear, but about being informed and proactive.
Right.
Knowledge is power, and the more we understand our bodies, the better equipped we are to advocate for our health.
So as we wrap up this deep dive, what's the one key takeaway you want our listeners to remember?
Early detection is everything. So many cancers are treatable, especially when they're caught in the early stages. So listen to your body, pay attention to those subtle changes, and don't hesitate to talk to your doctor about any concerns.
Beautifully said. It's all about being an informed advocate for your own well-being. Now that you're armed with this knowledge, what steps will you take to prioritize your health and make sure you're getting the care you need? That's something for you to ponder as we close out this deep dive. Until next time, stay curious, stay informed, and take good care of yourself.
Thank you for joining us on this important episode of Daily Health Alert TV News and Podcast. We hope today's discussion has provided valuable insights and empowered you to take charge of your health by recognizing subtle signs and symptoms that may need attention. Remember, early detection can make all the difference. So, listen to your body, stay informed, and don't hesitate to reach out to your healthcare provider if anything seems out of the ordinary. Before we sign off, make sure to like and subscribe to Daily Health Alert TV News and Podcast for the latest updates, deep dives, and more health-related content that can help you stay informed and proactive. Your support helps us continue to bring you essential health information. Until next time, take good care of yourself and your loved ones. Stay safe and healthy.